All right, so we're recording. Just as a quick introduction, my name is Derek Wolfgram. This is for my class, and the project that I'm doing is for uh, how first responders, those in public safety, and how we deal with the stresses and stressors that we come across. Um, if I ask a question and you don't feel comfortable in answering the question, that's fine. Just say I don't want to answer, and yeah, that's totally fine. Um, if you have a story that you want to say, that's or tell us, that'd be great. If you don't, that's fine too. Yeah, well, whatever. This is just a blog about how first responders deal with the stresses and stressors that we come across. So, and this episode we are talking about substance use disorder, which is where people get addicted to a substance, whether it be illegal or legal, and that can have a negative effect on their lives. Um, so, as a police officer, have you ever had or come across either yourself or someone out that you're dealing with this that has had like either a chronic or an acute um, addiction to some sort of substance?
Yeah, for sure, all the time.
All the time. Can you
hmm
tell me what you've come across or what you've dealt with?
Um, I, from anything from prescription meds to legal things, like alcohol, tobacco products, marijuana, just all the things, heroin, meth.
Which one would you say is the most common substance abuse that you've come across?
Probably alcohol.
Alcohol, which is a legal drug.
Right.
You can actually have it on your person once
hmm
you're how old?
21.
21. Yeah, very good.
Trick question.
So once you're 21, you can actually possess
hmm
and drink alcohol. Um, what about any illicit or illegal drugs?
What do we see? Is that what you're asking?
Sure. And
Okay.
what do you see, and what does that do to the relationships of the people that are involved with those?
Right. So we see a lot of, I would say meth is the top one, and then heroin. Things like cocaine, you don't see as often. Marijuana is becoming more prevalent. Um, I think that a lot of the domestics we go on and respond to, disorderly, any type of family problem, there's usually some type of substance involved. Not always, but I would say a big percentage of it, there is a substance involved, and it creates an issue in the family.
hmm this issue that it creates, does that have a negative effect towards the domestic violence, or is it something that people will lean on and say, hey, this is something that I can use to help my relationship?
Usually always negative. I've never seen it be a positive effect.
Okay.
So,
Um, and so let's talk a little bit about these domestic violence calls that you've dealt with when substance use and has been an issue.
mhm.
Is it a domestic violence because they are using these illegal illicit drugs, or is it a byproduct of it? Or for instance, they get in a fight and so they turn to the substance instead of using the substance first and then having the domestic violence happen afterwards, or
I
is it a
think it
little
could be a mixture.
a mixture?
It just depends if the person is using it as a coping mechanism, if the substance is the reason that they act the way that they're acting.
Mm-hmm.
So I think it could be a mixture, but either way, it's not helping. Um, it may feel better to you, but the way you're responding doesn't help.
Okay.
hmm
Uh, so let's talk about substance use disorder within public safety itself. Have you ever come across whether it be a fellow officer or a firefighter or an ambulance person that has had so much stress or anxiety or depression that they're dealing with, so that they turn to a substance to seek relief?
I can't think of anyone personally that I know in law enforcement. I have seen in some trainings I've done, they had an officer who was using prescription medications, for quite some time, and actually while on duty got in an accident because of that. So he was DUI off of the painkillers he was taking
While they were working.
while they were working. Nobody knew that was a problem, and his partners stated that they wish they would have known that he was having an issue so that they could have helped him rather than get to that point that he was at, because he was actually injured on duty.
Okay.
So that is the main reason that he got started on the painkillers, and then it just kind of spiraled from there.
So he was driving under the influence because of the painkiller.
Yeah.
It wasn't because he went from the painkiller to like heroin or fentanyl
Nope.
or anything like that.
Nope.
Then, okay. What ended up happening? Do you know, like, with that, if that officer was held accountable for their actions?
Yeah.
Like, were they
Yeah,
arrested
they
and?
charged him. Well, he was in the hospital because of the accident. It was on the highway.
Oh, okay.
So, but they did charge him in the criminal courts, obviously. So.
Wow.
Mm-hmm.
How do you think that affected his family? I'm assuming, was it male? Sorry.
Yeah.
Okay.
Mm-hmm.
And how do you think that affected his family, especially if he was married and had kids?
Mm-hmm. Well, I think how it would affect anyone's family, regardless if they're law enforcement or what. I don't know, just the thought that people are reliant on these substances instead of reaching out to people they should be reaching out to for help, like their family. I think that would be hurtful, and it'd be hard to understand on the family side. But again, I don't know them, so I can't really speak for how they feel. But that's how I would think that would feel.
So, let's see. I'm trying to think how I can word this. Outside of using a substance to seek relief from any incident, any stressful incident, what other ways are there that first responders can use to find relief, whether it's from a stressful call or depression, or in this officer's instance, where he was hooked and addicted to painkillers?
I think just having a person that you can talk to and tell them all the things that will help you, and just finding a hobby outside of work that's not a substance.
So you as an officer, do you have a hobby that you have to help reduce the stresses that you
I do
face?
photography, and I like to work out. So those are the two things. Me and my husband do that together. So it was kind of like a family outing, and it's fun.
Sorry, I know that you're working, so if you have
You're good.
if you have to
Make
go.
sure that someone's going with him. Sorry.
Okay, you're good. Thank you.